Hello and welcome to this episode on the social side of epidemics, lessons from the cholera crisis in Zamfara State. My name is Aisha. I am your host, and with me here is a very special personality. I consider him one of the youngest academic doctor in Kaduna State University currently, Dr. Kamaludeen Shehu. He's a medical sociologist and a consultant. Welcome, sir, and it's really a pleasure to have you on this conversation.
Thank you so much. Thank you for having me.
Thank you, sir. So it all started about a week ago when I came across a Reuters report stating that 8 people have died and 200 others were infected with cholera in Zamfara. And I thought to myself, who knows how many more lives have been lost since then? Because the report was actually published on the 28th of August 2025. And today it is Zamfara. Tomorrow it could be another community. And that was when I realized we need to talk about this. So personally, I am not very familiar with it. Like when I heard about the outbreak, I wondered, does cholera really kill? So literally, I have a lot of questions. And to begin with, when you hear about this outbreak, what does it tell you about how epidemics works in our society and what you think both the people and the government can do differently, sir?
All right. Once again, thank you very much for having me on this important conversation. When I first heard about the incidents, I was, as a medical sociologist, I was actually not looking only at the medical aspect of it, and I was actually looking at it, from different perspectives, and most especially from the perspective of society. Like you said, and like it was reported, 8 lives were lost, and with about 200 people infected. And you see, these people are from societies. Some of them, the 8 people that were lost, some of them are members of are the breadwinners in their various families. And those that were actually infected also are members of the society. So in one way or the other, it will hinder them from going out to fend or to actually look for what to eat, and thereby affecting their families and themselves as individuals. Then
True.
again, you see epidemics like cholera naturally are preventable with good, access to healthcare, and with uh, access to clean and drinkable water, and so many other infrastructures in the society. So they are most likely preventable. So now it doesn't just strike randomly like that. It actually looks at the fourth line of the society. The epidemics, most especially cholera, actually look for the societies that are vulnerable in terms of maybe being poor, in terms of lack of good and access to drinkable water, for example, and society where there's a lot of poverty and insecurity, for example. And this, when you link it to how things are working in society, it is not actually unconnected with the social inequality that we are witnessing in the society. If you look at the population that are actually affected, in most cases, there are societies that at the bottom, ladder of social, structure. So you shouldn't just look at it from the perspective of, being medical, issues, but also from the perspective of society and how it's actually affecting, issues and members of the society.
Wow. I would want us to consider a very important aspect because I was one of the one of the most popular epidemics that has hit Nigeria in recent time is COVID. And I remember during COVID, I just want to make reference to it. And I remember during COVID, there was a vaccine was introduced at some point, and there were just a lot of rumors about how the intention is to kill Nigerians and all of that, about how it's about like the main thing is to reduce the population of like Nigerians. That was really like, it was a very common rumor that was literally circulating as at that time. So what do you have to say with regards to fear and stigma spread faster than the epidemics itself?
All right. I think there are two things, that are involved. Number one, there is what we call historical mistrust. You see, over time, we have developed a lot of trust issues with our authority. For example, there was an error in 1996 on a certain issues like that. So there was an outbreak. Then the authority, I think, invited, or with the knowing of the authority, a pharmacy company like that brought a certain medication to Nigeria, and it happened exactly in Kano State around 96, Pfizer. So that medication did not pass through thorough clinical, examination. So it was actually sold to people in Kano, and it actually affected so many people around that time. So sometimes this issue of mistrust is what actually will now culminate into the rumor that you are talking about. Like you said, during COVID, there were a lot of rumor before the establishment, before the coming of the vaccine. Also, so it is not unconnected with what we have been witnessing, or what have been obtainable before, and what have you. So that is on one side. Again, on the second point is that whenever there's an issue like this, the government or the authority ought to provide information. If information are not adequately, provided, then people will naturally provide their own information, as per explanation to whatever is happening. You understand? Remember, during Ebola, there was a lot of misinformation about what medication we should take or people should be taking. A lot of people have taken salt. Some people have taken a lot of the medication, and it's all rumor. You understand? So what ought to be done is, whenever there's an outbreak, the government have to provide an official information as to the explanation of what is going to be obtainable and what is people are going to do to prevent such kind of issues or what. But in the absence of that, naturally people will come up with their own kind of explanation and rumor, and most especially with the issue of social media now. Before you know it, everybody will
things will start trending. And in a situation whereby you're sick, instead of consulting your doctor, you feel the best thing to do is to pray. So now there is so much belief attached to culture in solving medical problem. What do you have to say about that, sir?
That issue is not unconnected with one, lack of education, maybe illiteracy, and in most cases this is happening to the less privileged people in the society. Most of them, just like the people in those communities, about 11 communities are actually affected in Zamfara State. And those communities, in terms of low level of education and quality education, this is not unconnected with their economic, status. You sometimes don't blame people for not going to school. You blame the government, because what provision has the government? What have government do for them to provide them with, a good quality education and what have you? So one, people are not well educated, to that effect, and it's as a result of poverty. Then two, the lack of advocacy. Even without education, there should be a sort of advocacy from the government and non-governmental organization, as what people should do when they are in this kind of situation, you understand. So, and religion, even at the issue of religion, our religious leaders are also stakeholders. They need to educate people that yes, you have to believe in God and you have to practice your culture, but it has nothing to do with seeking medical, services and having, access to healthcare and what have you. There are two different things: belief and practicing culture or cultural practices does not hinder you from, having access to medical care.
Wow, that's awesome, sir. Thank you so much for that powerful point. So now we've been able to highlight one or two factors that could actually lead to the fast spreading of these epidemics. Now we need to also look at the solution. And when we talk about solution, people are often focused on what government can do, forgetting the role that the people also have to play in this whole thing, because at the end of the day, it affects the people the most, particularly, especially the less privileged people. So in terms of solution, what do you think? What kind of solution do you recommend? What are the practical steps that everyday Nigerians can take in a situation like this?
You see, cholera as an epidemic is a waterborne disease. Therefore, the first thing that should be done is that people should be doing is having what they have to be practicing washing their hands, with good and clean water and soap. That is number one. Then number two, the water that they are drinking should be treated. You understand? They boil the water. If they have the chemical for chlorination, they can, chlorinate the water and just ensure that they are taking good water. You understand?
Water.
Then proper sanitation. Their environment has to be clean. You understand? You don't wait for government to come and clean your environment for you. So there ought to be sanitation. Their environment has to be sanitized. Then also even waste management, practices. You have to know where to keep your waste. When we are disposing our waste, we know where to go and dispose them. You don't keep, dirty things around you and what have you. And I think the congestion, in our places, in our rooms and in our houses has to be looked at, you understand, because in most cases, too much, congestion in our houses also can lead to diseases like that. So I think those are some of the basic, things that should be done without the interference of the government, but also government as a stakeholder, you understand. So government should ensure that there is access to healthcare, you understand. People, then other infrastructure like road, you understand, like water, access to good and clean water, electricity, and so many other things. And most importantly, in Zamfara State, there ought to be, security, because even if those people that and the society that are affected, they don't have, even if they want to go to the hospital, there is fear that something might happen to them on their way, so they can't go to anywhere. And even if they can go to the hospital, the health workers will not be there because they have fled to the city of Gusau and whatever. So you will not meet anybody there. Everybody is actually scared of the bandits and what have you. So even if they go in the event that they struggle to go to the hospital, they will not meet anybody there. So these are some of the cases. The issue of insecurity also is actually contributing to the escalation of the epidemic.
Thank you so much, sir. This has been very, very insightful so far. So we are coming close to the end of this conversation, and I have one very last question for you. So if you have just one message for both the people and the government, what would that be?
I think there should be a component, or there should be a component of the primary health care that should be established exclusively for epidemics like cholera. You understand? In our primary health care, if not building a new primary health care that will look at that disease, then there should be a component in that primary health care that will focus. Their own focus is to deal with epidemics such as cholera and waterjet.
Oh. So is that for the government or the people?
Yeah, it's for the government. Primary health care is, we have like in every ward there ought to be one primary health care. So, and in local government, for example, in Kaduna North, we have 12, wards, which means we have about 12 primary health cares. So if in any of these primary health care, there's a component that focuses on epidemics such as cholera, it will be helpful. Okay,
so that takes us to the people. What message, if you have one last message for them, what would it be?
It's all right. Epidemic is preventable. Cholera is preventable. It's just to take the right steps. And people that are actually affected or infected shouldn't be stigmatized. It can happen. It can happen to anybody.
You see, today's conversation reveals a hard truth. The cholera crisis in Zamfara is not just about bacteria. It's about poverty, mistrust, and systems that fail the communities. Because at the end of the day, cholera are as social as they are medical. And to be able to solve it, it requires everybody. Everyone has a role to play. So to the people, we urge you to take necessary precautions to safeguard your well-being. And lastly, to the government, I urge you to take proactive measures as it has previously been discussed, rather than waiting for fatalities to occur, because I feel the safety and security of the people should be the utmost priority of any government. Thank you for joining us today, and we look forward to seeing you on the next episode. Thank you.